welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the program, and so let's get started. Mike, thank you for hanging afterwards for us. We had it from Facebook. Mary said, can you speak to the stages of heart failure and if you can improve from stage to stage? Can you improve heart failure?
Yes, you definitely can. You just need to go to somebody who is experienced in managing that. And so you usually come in decompensated, and then we can adjust your medications and find out therapies to reverse the trend.
Okay. Teresa said, how effective are compression socks for blood clots?
Compression socks are usually used for after you've had the blood clot, because the little valves that regulate your venous flow become damaged by the blood clots, and the compression tends to keep the fluid from leaking back into your legs, but they don't prevent blood clots.
No, but boy, what a huge improvement for people who have venous problems. And I mean, I've been a big supporter of the 20-pound, 30-pound Jobst type, really tight stuff, not the weak stuff.
Yeah, the white socks usually don't do anything.
No.
These are ones you have to buy at the drugstore.
Yeah. Sometimes if I reach across my chest with either hand, this is from Dolores, I get a sharp pain in my chest. Is this something I should worry about?
No, I can tell her categorically that's not her heart.
This is not heart?
No, absolutely not. It's musculoskeletal because it's related to changes in position.
Right. What is coenzyme Q10 and what does it do?
It's a drug that's commonly used to deal with side effects from cholesterol pills.
Like Crestor, and that's another question. A Rapid City woman, can the drug Crestor make your muscles hurt, and how effective are they compared to lifestyle changes?
The deal is you inherit the genes for handling your cholesterol. So you have green eyes. If you wanted them to be brown, they're going to be green, no matter how hard you work, what you eat. And that's a little bit true for your cholesterol. So you can become a vegetarian, and your cholesterol may still be elevated if you have the genes for that. That's what the medicines are for.
Okay, and can they make your muscles hurt?
They can do that, but if you think about the fact of how many, in 2006, the worldwide take for just one drug was $9 billion. You think about how many people that is. So they're probably the most studied and safest drugs to take in our toolbox.
But I would argue, and yeah, I'm not a cardiologist, you are, but I see, particularly as they get older, they have more and more problems with those lipid-lowering statins, and the risks are higher than the advantages at a certain point of that.
The deal is that's true for any pill, but the one thing I would say is if you go down to the local grocery store and you ask the first 100 people that come in who are 65 or 70 years old if they have any aches or pains, how many of them you think will check the box?
Yeah.
Everybody.
Okay. A woman is on warfarin, is wondering what she can and cannot eat with the medicine. Okay, so warfarin can be affected by the foods that we eat.
It can be affected, but as long as you have a stable diet, you don't want to eat no vegetables, and the day before you go get your blood thinning level checked, you have
greens and collard greens.
Yeah, exactly, because you'll destroy that. The other thing is a lot of people take vitamins, and they don't think about that those vitamins may have vitamin K in your vitamin. So make sure to read the bottle if you take Coumadin, because vitamin K opposes the Coumadin.
Right. And the women's studies showed that there was no advantage to a multiple vitamin in the 30,000 women that were taking either none or taking a multiple vitamin, no difference in groups. We have a question from Vicky. Sometimes my heart will start to beat fast for no reason, mostly at rest. Should I have this checked?
Yes, definitely.
You think it's PAT?
I don't know. They need to find out.
Bingo. What should somebody do for exercise if they have a weak heart and chronic obstructive pulmonary disease, COPD?
They actually have a great program at a lot of even smaller communities called pulmonary rehab. And I've seen people double and triple their ability to exercise, even with that array of problems.
Bingo, an exercise program. How successful is Brilinta, a blood lubricant after having stents, in preventing clots after stents?
It's very effective. It's the one we use preferentially if you came in with what we call a STEMI heart attack, which is the emergency heart attack.
Right.
Massive heart attack.
How does it work? What is it related to? Is it an aspirin platelet?
It's like Plavix. It's an antiplatelet. It affects your blood clotting system, different than Coumadin, different from many of the other pills. It has very unique pharmacologic characteristics.
Can you discuss viral heart infections, Mike?
Yes. You know, viruses can affect anything in your body. We talk about shingles, you know, the tremendous rash that people can get, that people are familiar with that. Imagine what that shingles would be like if it happened to your heart. And so it can be damaged permanently. Sometimes it's reversible. And you can have viruses that go through and it just sideswipes the heart as part of its damaging effects.
Okay. So, but a whole variety, like you say, it can just be all sorts of different things. One of them, I've seen a guy come horrendous heart failure, barely stayed alive, and then he came right back to normal.
Right. Possible to do as the virus pitches out, then sometimes you get better, but it can, some viruses can be like polio, where the damage is there
and gets worse.
And stays there, or it gets worse.
Yeah. What do you mean by heart failure exactly? What are the symptoms of heart failure? Getting tired easily a symptom?
Yes, tired, shortage of breath. If you have left heart failure, fluid builds up in your lungs. If you have right heart failure, the fluid builds up in your legs.
What do you, caller has been diagnosed with weakening heart vessels and is wondering what he can do to prevent further damage. He's 66, quit smoking 2 months ago. Congratulations on that. Stay off the cigarettes.
That's a dramatic thing that you did. If you smoke for many years, very difficult to stop.
Very hard.
But that is probably one of the best things you can do to try to strengthen your blood vessels. And the benefit will continue to accrue for up to 6 months after stopping smoking.
Okay, and then is there, I think, a regular walking program as well?
Yeah, definitely.
Here's from Rita. Can chemotherapy drugs cause harm to your heart?
Yes, there's a whole discipline on that. And we have a specific...
Adriamycin in particular.
Adriamycin and trastuzumab, which is another drug used for the treatment of breast cancer. And so many of those people that take drugs that could be toxic to your heart, you don't want to trade the cancer for heart failure.
Right.
So they get an ultrasound before your doctor starts your chemotherapy, and then periodically as you get the chemotherapy, they check it to make sure that the heart's not being damaged. If it is, looks like it's being a problem, they change your chemo.
Right. Very important part. It depends on the chemo, and most of the time, the oncologist will order that echo.
Right.
That's important. Sioux Falls woman asks, what is more serious, atrial fib or small blood vessel post-stroke? And I presume when she says is atrial fib or the stroke related to probably blood vessel disease in the carotid.
The thing is that atrial fib is responsible for about 30%
of
the
all
strokes. But it's not the cause of all strokes. And so when you have a stroke, even if you have atrial fib, the doctor still has to make sure that the atrial fib was the cause of your stroke. Mm-hmm. Because those things are so common. Stroke's very common, atrial fib very common. They want to make sure, though, what's causing your problem so that they can devote, because some people get blockages, as you're pointing to your neck there. Some people can get damage from high blood pressure. Biggest risk to you of high blood pressure is a stroke, not a heart attack.
How often does someone have a blood clot after going off of Brilinta?
The deal is it depends on when you went off. So if you just had a heart attack last week and you said, I wanted to go get my cataract fixed so my doctor stopped my Brilinta, you have a very high risk of clogging up your stent. If it happens 8 months after you had the stent put in, well then you've had all that time to heal, and the likelihood of forming a blood clot then is much less.
So you generally keep people on Brilinta for 6 months?
6 months minimum and for a year is the guideline.
And then you switch to Plavix or aspirin?
And sometimes I switch to Plavix earlier on because Brilinta is quite expensive. And so once you get the more healing going on, then you can switch to Plavix. But you know, somebody was asking about genetics earlier. Plavix can work for you or not work for you depending on your genes.
That's an important question. A few months ago, we heard of research indicating that chocolate can reduce the incidence of atrial fib. What do you know about that?
I think I would be very popular if I was prescribing chocolate to everybody that had atrial fib.
So
my clinic would be overrun. I'm busy enough.
Not the answer.
Not the answer.
No. A 61-year-old man from Sioux Falls with a heart murmur, but have not needed any medication. I passed Planet Heart with flying colors recently, but I wonder if I should have an echocardiogram to be sure. So what the significance of a heart murmur? How many people do you listen to that are normal in every way but have a murmur?
Everybody has a heart murmur.
Yes.
Everybody. From the day you're born till the day you die, unless you're so fat that we can't hear, or that you have such bad emphysema that we can't hear. And the way I explain that to people is you can hear the water running in your house, but it doesn't mean you have clogged pipes. So as far as you're concerned, there's two types. Murmurs you need to worry about and murmurs you don't need to worry about. And that's where your doctor comes in.
There you go. Have you found that elevation affects heart failure? I have found that when I'm in Rapid City, I have to take more Lasix than when I'm in Arizona. I can cut my dose in half, actually, in Arizona. I think that's a true thing. Have you noticed this?
The elevation isn't so much the thing as it affects your oxygen. That's the first thing. And number two is if you're in Rapid City, maybe you're on vacation and you're bending the rules a little bit by eating things that are too salty, you're on vacation, so you're letting things slide a little bit.
Having a couple extra glasses of wine.
Extra wine, lemonade, iced tea, whatever the thing is, because you're on vacation.
Jim Engelbrecht from Rapid City. Dr. Engelbrecht, thank you for calling. Continue comments on who should begin PCSK info.
Yeah, so this is a very good question. This is a very, very expensive medication. It's hard for me, and I'm on.
So what is it again? PC.
It's a drug for cholesterol, basically. It's
that injection for cholesterol.
Right. It's an injection for cholesterol.
What do they call it? What's the brand name? It's
Repatha.
Yeah. Okay.
And so it's a very expensive drug. But the thing is at some point we're going to have to decide what can we afford. I'm on the P&T committee, and I know Jim very well, dear friend. And the deal is we just approved a drug the other day for treatment of cancer that costs $15,000 a month. So who can afford a pill that costs $15,000 a month, and who's going to pay for that? And the same thing is true for this. It's hard for me to justify giving people this when they weigh 300 or 400 pounds, or 250 pounds even. So the first thing to do is diet, because that's for free. And we already spend 19 cents on every dollar on health care. And we're the 26th healthiest country in the world. The healthiest people in the world, the Southeast Asians. And everybody knows what one looks like.
Skinny.
They're skinny.
Well, this really
I don't have anybody on this. I had one person I was considering it for because they had done everything. They had lost weight and they were exercising and everything, and they just had bad genes. And so, but it would be a very select group of people. But of course, the drug companies are more than happy to direct market to people. There's commercials on TV, and then people look at this as, oh, I'll just go in and get a pill.
Well, my suspicion is, and I can't say this for sure, but my suspicion is that they are presuming that the consequence of this medication is related to the cholesterol that it lowers, but they have not proven that it saved a life.
Oh, it does reduce.
I know it reduces cholesterol.
No, but it does reduce mortality. They know that. They know that it does reduce hard endpoints. The issue is, can we afford to do it that way, or should we just get people to live healthier is what they should do?
All right. That's a tough issue, isn't it?
It's a very tough issue.
Long-term prognosis for a man 64 with Brugada syndrome, diagnosed in 2002. And he's on quinidine and propranolol and CPAP, and he's had less atrial fib since he's been on CPAP. But what is Brugada syndrome, and what's his long-term prognosis?
Brugada syndrome is an electrical disease of your heart, okay, and it oftentimes is treated with a defibrillator, and it usually should be managed by an electrophysiologist. Now,
which is a cardiologist that is a rhythm specialist.
He's a specialist, and I call them electricians because they're electrical physicians for the heart. And they've been trained to manage that. And so whoever's managing those drugs, which have many toxicities, and I'm not trying to put this person on point, but you want to make sure that if you have a Maserati, you go to a Maserati mechanic. You don't want to go to somebody that...
Who just does Chevrolets.
Yeah, just
Nothing
does
wrong
Chevrolets.
with Chevrolets.
Right. I don't want to get a nasty note from the Chevrolet dealer now. But the deal is that this is a very specific disease, has a very specific set of circumstances. And if you get guidance for how to manage that, lifestyle-wise, then you can go on and have a very long life. But you have to get somebody who knows how to manage it. Yeah, Maserati mechanic.
Yeah. Mike, thank you so much for joining us and staying later for the after hours questions.
It was a pleasure. I always love coming here. I learn more, I get more than I give.
Thank you. And thank you for joining us on our Facebook page. We appreciate all your questions and the opportunity to answer them. So until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.
Call with the Prairie Doc is very important to a lot of people in this area and in this region because it communicates a lot of very valuable information on healthcare, medical issues, answers specific questions. This project takes dollars. We have people in studios and we have people that have to be paid and we have to do production costs, even though Dr. Holm's time, our time, the guest time is all donated, we still have production costs. We have a great foundation called the Healing Words Foundation that oversees this whole operation and is responsible for some of the fundraising to promote these programs. If you like this program and you enjoy the information you're getting and you find it's valuable, please feel free to go to our website and donate. We would really like to have some additional financial support, and it's very simple to do. And again, it'll keep this program going for the foreseeable future. So the website is prairiedoc.org, O-R-G, prairiedoc.org. Go there, donate if you're so inclined, and we thank you very much.